Hello, and thank you for listening to my presentation today. My name is Crystal Schwind, and I'm an RN. Today we'll discuss incorporating evidence-based care with remote collaboration in the Vila Health Remote Collaboration Evidence Care Scenario. In the Vila Health scenario, tells us of a 2-year-old toddler, Caitlin, who was taken to the ED for pneumonia for the second time in 6 months. Her past medical history includes meconium ileus at birth. Her breath sounds are diminished with an increased respiration rate of 32 breaths per minute with thick secretions. Her weight is below average at 20.7 pounds, and she has a nutrient malabsorption with sweat chloride tests that resulted in 65 milliequivalents per liter. Caitlin's past medical history and symptoms indicate she has cystic fibrosis. This presentation will review an evidence-based care plan for cystic fibrosis, how evidence-based practice models can help develop a care plan, and reflecting on the evidence that is relevant and all the challenges of remote interdisciplinary collaboration. So I'll first go over my care plan of cystic fibrosis. Cystic fibrosis is an inherited disease that causes damage to the lungs and digestive system. It produces thick mucus that is thick and sticky, leading to pulmonary inflammation and a higher infection rate, cystic fibrosis liver disease, cystic fibrosis related diabetes, and pancreatic exocrine insufficiency. CF reduces the absorption of vitamin D, which also causes reduced lung function. As a result, Caitlin will need additional nutritional support, and nutritional education must take place with Caitlin's parents. A registered dietitian referral is recommended to ensure Caitlin's parents receive the most current relevant nutritional information regarding CF patients. These care plan interventions, along with the recommended pancreas enzymes, high protein and calorie diet, and fat-soluble vitamins, A, D, and E, will help gain and sustain her weight and improve her lung function. Respiratory function is essential to be managed during Caitlin's plan of care. Poor lung function and thick secretions in CF patients can lead to a secondary bacterial infection. According to the National Heart, Lung, and Blood Institute, there's different treatments to prevent this, including airway clearing techniques and medication. Some airway clearing techniques that may benefit Caitlin include special breathing and coughing exercises that can be taught as she gets older, physical chest therapy, and a special vibrating vest that helps loosen mucus and secretions as well as she gets older. Some medications that can also help prevent or treat infections are antibiotics, anti-inflammatory medications like corticosteroids and ibuprofen, some bronchodilators, mucus thinners, and CFTR modulators, such as ivacaftor and lumacaftor. The last part of our care plan involves preventing and managing constipation and distal intestinal obstruction syndrome, otherwise known as DIOS, a common complication of CF. DIOS happens when feces accumulate with sticky mucus, forming a mass in the distal small intestines. To prevent CF complications, laxatives should be administered as ordered for Caitlin, along with educating her parents about the signs and symptoms of DIOS and constipation. Next, we'll talk about the interdisciplinary collaboration challenges that may arise. Caitlin and her family reside in a rural area that does not have specialists nearby that are familiar with the CF diagnosis and treatments, further complicating her care and treatment. Telemedicine is an efficient, convenient, remote delivery of care, which will educate Caitlin's parents and ensure consistent, fast care. Telehealth, also called telemedicine, would be the best option for both Caitlin's parents since they both work late hours and after-hour appointments via Skype would be possible. Caitlin would need appointments with a respiratory therapist, a registered dietitian, and other medical professionals when her symptoms are exacerbated or when they have simple questions to ensure proper treatments are being performed. More frequent Skype telehealth appointments mean more frequent care and contact from the healthcare professionals, lowering the potential infection rate, travel costs, and hospital admissions. A challenge that may arise is poor internet connection in a small town of 100 people. Caitlin's parents should work with case management to provide them with resources on discounts for better internet options in their rural town, such as internet providers that specialize in rural areas, like Comcast Xfinity, for example. Telehealth appointments are Caitlin's best option plan of care to ensure consistent, patient centered care to help her and her parents navigate this new diagnosis. I'll next go over the EBP model that was used to develop this plan of care. The evidence-based practice model used to develop Caitlin's care was the Knowledge to Action Framework model. This plan best fits Caitlin and her family as it's easy to follow and uses interdisciplinary healthcare professionals who work together to create and reevaluate those goals as she grows. This creates a unique patient-centered care that is effective and efficient for her needs. Caitlin's plan will utilize nurses, physicians, respiratory therapists, social workers, and registered dietitians to ensure her needs are met. Another phase of this model is adapting information to the audience, which would be Caitlin's parents. Caitlin's parents will need continuous, easy to understand education about CF interventions and signs of distress now and as the disease progresses. Knowledge barriers will be identified. Interventions will be put into place to meet Caitlin's needs and her parents. As a result, the care plan may also change as Caitlin grows and ages. Managing her disease in her home will lead to fewer hospital admissions. So I'm going to go over the most relevant, useful evidence that I thought was found. The most relevant and helpful information evidence I found was by Timmers, ETL 2019, and Carroll, ETL 2021, to help develop my care plan for Caitlin and her family. Timmers goes over the importance of fat-soluble vitamins and absorption for lung development and overall function. And I thought Carroll explained how preventing DIOS is essential and is one of the most severe complications of CF. In conclusion, the cystic fibrosis is scary and an overwhelming diagnosis for any family, let alone a family living in a rural area with limited resources to manage this disease. However, by using interdisciplinary approaches, knowledge to action evidence-based practice model, and telehealth Skype services, all of Caitlin's medical needs will be met, with better equipping her parents to manage her disease adequately. Thank you again for listening to my presentation.